Chronic myeloid leukemia, often abbreviated as CML, is a type of blood cancer that affects the bone marrow and blood. In a healthy person, the bone marrow produces blood cells in an orderly and controlled manner. These blood cells include white blood cells, which fight infections, red blood cells, which carry oxygen, and platelets, which help with blood clotting. However, in CML, something goes wrong with this process, specifically in the production of white blood cells. CML starts in the bone marrow, where blood cells are made. It affects a type of white blood cell called myeloid cells. In CML, the body produces too many immature white blood cells, called myeloblasts or leukemia cells. These abnormal cells build up in the bone marrow and spill out into the blood. Over time, they crowd out healthy blood cells, making it hard for the blood to do its normal job. Now you might wonder why this happens. Well, at the heart of CML is a genetic problem. Most people with CML have a specific genetic change called the Philadelphia chromosome. This chromosome forms when pieces of chromosomes 9 and 22 break off and trade places. The switch creates a new gene called BCR-ABL, which leads to the production of a protein that tells the leukemia cells to grow and divide out of control. We will get to what causes this genetic problem in the causes part. But now, how common is CML? Well, CML is considered a chronic leukemia because it typically progresses slowly compared to acute leukemias. It often takes months or even years for symptoms to develop. This slower progression gives doctors more time to treat the disease, which is good news for patients. CML is not one of the most common cancers, but it's not super rare either. It accounts for about 15% of all leukemias in adults. In the United States, there are about 8,000 new cases diagnosed each year. It can occur at any age, but it's most common in older adults, with the average age at diagnosis being around 64 years, and it's slightly more common in men than in women. Causes of CML. As mentioned earlier, the Philadelphia chromosome is the main culprit in most cases of CML. But what causes this genetic change in the first place? The truth is, we don't fully understand why this happens in most cases. It's not typically inherited from parents, but rather it's an acquired genetic change that happens sometime during a person's life. There are a few known risk factors that might increase the chances of developing CML. Exposure to high doses of radiation is one such factor. For example, survivors of atomic bomb blasts or nuclear reactor accidents have a higher risk of developing CML. Some studies have also suggested a possible link between long-term exposure to high levels of benzene and an increased risk of CML, but this connection isn't as clear. Age is another factor, with the risk increasing as we get older. However, it's important to remember that most people with these risk factors don't develop CML, and many people who do get CML don't have any known risk factors. Symptoms of CML. In its early stages, CML often doesn't cause any symptoms at all. Many people are diagnosed after a routine blood test shows abnormal results. When symptoms do appear, they can be vague and easily mistaken for other conditions. Common symptoms of CML include feeling tired all the time, even after a good night's sleep. This fatigue can be frustrating and make it hard to get through daily activities. Another common symptom is unintended weight loss. People with CML might notice their clothes becoming looser without trying to lose weight. Some patients experience night sweats, waking up with their pajamas and sheets drenched. Fever is another possible symptom, though it's usually low-grade. Many people with CML also notice they bruise or bleed more easily than usual. This can show up as frequent nosebleeds, bleeding gums, or bruises appearing without any remembered injury. As the disease progresses, people might feel a sense of fullness or discomfort in the upper left part of their abdomen. This is often due to an enlarged spleen, a common feature of CML. The spleen can become swollen as it tries to filter out the excess abnormal blood cells. Some patients describe a general feeling of being unwell, almost like having a mild flu that never quite goes away. They might lose their appetite or feel full quickly when eating. Bone pain can also occur, particularly in the legs. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of CML. Diagnosing CML typically starts with a blood test. If a doctor suspects CML based on symptoms or routine blood work, they'll order a complete blood count. This test measures the levels of different types of blood cells. In CML, the white blood cell count is often very high, sometimes more than 10 times the normal level. The test might also show a low red blood cell count, or anemia, and an abnormal platelet count. If the blood test results suggest CML, the next step is usually a bone marrow biopsy. This procedure involves taking a small sample of bone marrow, typically from the hip bone. It's done under local anesthesia, and while it can be uncomfortable, it usually only takes about 10 to 15 minutes. The bone marrow sample is then examined under a microscope to look for leukemia cells. To confirm the diagnosis and determine the specific type of CML, doctors use specialized tests. These include cytogenetic testing, which looks for the Philadelphia chromosome, and molecular testing, which checks for the BCR-ABL gene. These tests are crucial not only for diagnosis, but also for monitoring how well treatment is working later on. Once CML is diagnosed, doctors determine which phase the disease is in. CML has 3 phases: chronic, accelerated, and blast. Most people are diagnosed in the chronic phase, where the disease is slower growing and more responsive to treatment. In the accelerated phase, there are more immature blood cells, or blasts, in the blood and bone marrow, and symptoms may worsen. The blast phase, also called blast crisis, is the most severe, where the disease acts more like an acute leukemia. Treatment for CML. The good news is that treatment for CML has improved dramatically in recent years. The introduction of targeted therapies called tyrosine kinase inhibitors, or TKIs, has revolutionized CML treatment and greatly improved outcomes for patients. TKIs work by targeting the protein produced by the BCR-ABL gene, effectively shutting down the signal that tells the leukemia cells to grow and divide. The first TKI developed for CML was imatinib, or Gleevec, and it's still widely used today. Since then, several other TKIs have been developed, including dasatinib, nilotinib, bosutinib, and ponatinib. These drugs are taken orally, usually daily, and many patients can manage their CML as a chronic condition with these medications. The goal of treatment is to achieve remission, where the number of leukemia cells is greatly reduced or eliminated. Doctors monitor this using blood tests and bone marrow tests. They look for 3 levels of response: hematologic, when blood cell counts return to normal; cytogenetic, when no cells with the Philadelphia chromosome are detected; and molecular, when the BCR-ABL gene is at very low levels or undetectable. While TKIs are the main CML treatment, other options may be used in certain situations. For patients who don't respond well to TKIs or who can't tolerate them, chemotherapy might be an option. In some cases, particularly for younger patients or those with advanced disease, a stem cell transplant might be considered. This procedure replaces the patient's bone marrow with healthy bone marrow from a donor. Living with CML and its treatment can be challenging. TKIs, while generally well tolerated, can have side effects. These might include nausea, diarrhea, muscle cramps, fatigue, and skin rashes. Most side effects are mild and manageable, but it's important for patients to communicate with their healthcare team about any issues they're experiencing. Regular monitoring is a crucial part of CML management. Patients typically have frequent blood tests to check their response to treatment and to watch for any signs that the disease might be progressing. Bone marrow tests are usually done periodically as well, especially in the first year or 2 of treatment. Now we want to hear from you. Do you or someone you know have chronic myeloid leukemia? What symptoms did you have? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.